Taking proper precautions while performing CPR can reduce the fear of attracting a disease. Documented traces of disease transmission during actual CPR are very rare, and no reported cases have happened during CPR training. You can better protect yourself by body substance isolation techniques, such as wearing medical exam gloves and using barrier devices, such as shields or face masks during resuscitation. A shield comprises of a transparent sheet with an opening containing a filter. Place the sheet over the patient's face, covering the mouth and nose. A ventilation may now be given in the normal way, that is, head tilt, pinch the nose, and breathe into the patient's mouth via the opening. A face mask has a one-way valve that diverts exhaled air away from the responder. There are different sizes for adults, children, and infants, so make sure you select the appropriate size for the patient. The mask should cover the patient's mouth and nose. It should not extend over the patient's eyes. Make sure you see the chest actually rising with each breath you give. We will now go through the process of using the face mask. You may kneel beside or above the patient's head. Seal the mask by placing the index finger and thumb of your hand closest to the patient's forehead, along the top border of the mask. Now, place the thumb of your other hand along the lower border of the mask. Open the airway as normal using a head tilt chin lift. Press the mask down and lift the jaw to hold the mask tightly against the face, and give a breath lasting 1 second, watching for chest rise as you do so. If you are kneeling above the patient's head, seal the mask by placing the thumbs of both hands along the side borders of the mask. Now place the fingers of both hands underneath the jaw. Open the airway as normal using a head tilt chin lift. Press the mask down and lift the jaw to hold the mask tightly against the face, and give a breath lasting 1 second, watching for chest rise as you do so. Your instructor will now take you in your groups through the steps of ventilating a patient using a face mask.